right now.
You look great, Virginia.
Oh, thank you, Mel.
Now I'll mute myself again.
Yeah. No, you can keep saying that. Great, this is great. I'm really happy with the turnout. And like, I want to start with a great big thank you to all of you volunteers. So, you know, I think it's wonderful that you guys sort of dedicate your spare time to helping out the kitties like this. And so those of us who are paid to do this really appreciate those of you who do this for free. When I had first talked to Janet and Nicole about doing this, it was just, you know, what I wanted to do is just see if we could sort of find a way to more cohesively make sure that we're giving the best care possible to the cats, because there's just little areas that we found that, oh, there's maybe a disconnect happening there where we can, if we worked more collaboratively together, we can make sure that these guys get the best care possible. So a few little points just to touch on, but I think the Q&A part of tonight's discussion is going to be my favorite part, because you guys probably have a lot of questions about things that I don't even know that you have questions about. So they're probably things that I think that, you know, I just assume that you guys already know the answers to, or I may have never even thought that they would be questions. So I'm just going to start with a few quick things, and then we can get on to the question and answer part, I think, pretty soon. So, like, from our perspective, the program is running, I think, really well right now with the great team of volunteers and sort of the way you have the program established with the fosters and the leads, and I guess the leads have people that they report to. I don't really know all of the sort of the mechanics of it, but I do know that when you guys bring the kitties to the clinics, sometimes we get questions, or we feel sort of put on the spot sometimes, where you guys are asking us, okay, what do we do? Or, you know, how do we treat this? And we feel bad that we can't answer those questions for you. And it's not that we don't want to answer those questions for you, but out of respect for the way that things work, and also because for legal reasons, because technically you guys don't own the kitties, that the shelter owns the kitties, we can only legally give medical information to the people that we have been previously told that we can provide information to. And there's certain people that have been named that can make medical decisions. And so those are the only people that we are allowed to communicate with as far as making medical decisions. So I know you're very curious sometimes to know what's going on, how should we treat this? And we're not being evasive when we kind of dodge and weave those questions. It's just that for legal reasons, we aren't allowed to disclose medical information to anybody but the legal owners of the pets. And we can't make medical decisions with anybody but the legal owners of the pets. But we do know that that information will trickle its way down to you guys eventually. So what happens kind of inside the guts of the building once that cat's admitted, or even just comes in for outpatient appointment, is once we've seen the kitty, if it's, you know, a critical issue, then we're immediately in contact with Nicole or Janet and getting medical consent to perform whatever procedure needs to be done. If it's not a critical situation, then oftentimes we'll discharge it back to you and communicate at some point during that day, either by email or phone. And we might send the medication back with you guys, but that information will get sent through to the people that we do have the permission to communicate with about how to administer the medication, how long to administer it, and why we're using that medication. So I know it's frustrating for you because you want to know, and oftentimes those kitties are living in your home, so you really want to know why you're applying that medication or giving that medication. But be patient. It's just got to trickle down through the legal channels before that information can get to you. On the topic of pets coming into the clinic, one of the big topics that has come up over the last little while is the safety and use of something called gabapentin. And gabapentin is a little bit of a wonder drug when it comes to cats. It is got multiple uses, and so gabapentin can be used for pain control very effectively. Gabapentin can be used for sedation very safely, and gabapentin can be used to relieve anxiety. So I love gabapentin for especially scared kitties. And if you are bringing in a cat from, I think you guys have a room at the shelter that is for cats that are maybe feral or had been feral or not well socialized or handled in the past. And so those guys, you cannot get into trouble by giving them gabapentin. And what that will do for the cat is to minimize stress and minimize stress-related disease. So when they come into the clinic, which is pretty much the most stressful thing that's going to happen in their week, potentially the year, when they come in, that will make your life easier, because generally the way we like gabapentin to be used is if you know that they are coming into the clinic, say on a Tuesday, give it to them Monday night, mix it in with their supper so they can eat it on Monday night. They can eat it for breakfast again on Tuesday morning, because it does take 1 to 2 hours to take effect. So feed it Monday night and again on Tuesday morning, and then they can come into the clinic feeling much more relaxed, slightly sedate, and the whole sort of moving them from whatever enclosure they're in. And I think they're in a ferret cage sometimes, if I understand. So moving them from that enclosure into a transport kennel to come into the clinic will be way less stressful on the kitty, way easier for you guys. And then moving them out of their carrier into our hands at the clinic will be way less stressful. The exam, whatever we're doing, whether it's taking blood, giving medications, doing surgery, whatever the treatment is, will be way less stressful. So those kitties are less prone to injuries. They are less prone to stress-related disease. And they're less, like we're less prone to getting injured. You're less prone to getting injured. And they are less prone to having some adverse events associated with going into a stress-related event. And so what can happen sometimes when cats get extremely stressed, it's fight or flight. And some of these kitties will come in absolute panic mode, and they're so scared. And you probably see it when you're trying to even move them from their ferret cage into a carrier. They go into absolute panic mode, and all they want to do is survive and get away, and they don't understand that we're trying to help them. And so they will literally try and climb the walls or get on the ceiling or do anything to just try and escape from wherever they are, and their heart rate goes way up. They'll do that until they actually will lose consciousness sometimes. So using something like gabapentin will just keep them more relaxed and make it a safer event for them. And again, it's absolutely safe. So even if we have a patient that has neurologic disease or who has really significant and severe cardiac disease, that is absolutely safe to give them. And so we can't really get into situations where it's a bad decision to give it to them. We have had situations before where cats have come in and we've questioned, you know, did they get their gabapentin? And the answer was, well, no, they didn't eat. And then we look at the cat and the cat's like 18 pounds and we think, well, this cat doesn't look like he misses too many meals. And so, you know, the capsules can be opened up and then the powder inside the capsules just mixed with food. You don't have to give them their entire meal. So just give them a teaspoon of food with the gabapentin powder mixed in if they won't take the capsule directly. So that's another way of getting it into them. And if you have an 18-pound cat, maybe 100 milligrams isn't enough. 200 milligrams might be enough to give that cat. So they may need a much higher dose than your typical 10, 12-pound cat. So please, if you are unsure whether this cat is going to want to get in a carrier or want to come to the clinic, give it gabapentin. Absolutely. There should be a big stock of it at the shelter. We've dispensed lots for it to be there. So absolutely go ahead and give it. It's only a quality of life thing for the cat and for us, but for the cat mostly. So there's never a situation where we're going to say that was a bad decision. There's absolutely never a situation where we're going to say that's a bad decision. 90% of the time when any cat comes into the hospital for a surgical procedure, they get that first thing when they walk through the door. So we're going to give it anyways. So I see a question coming up and I'm going to address that one right away. Yes. So prior to surgery, we do like them to be starved out, but they don't have to be absolutely starved out. And the reality is, for most cats that are having surgery, they don't get it the second they walk through the door. So the normal stomach emptying time is at least 2 hours. So it's 2 hours, maybe a little bit longer. But if they've had gabapentin, you know, at the shelter prior to coming in, mixed with a little bit of food, by the time they get to the clinic, go through the sort of surgical intake procedure where they get their physical exam, get their heavier sedation, get their IV placed, have their blood work done, and then it's time for their induction and their full surgery. By the time they get to the point where now we would prefer them to have an empty stomach, there's been way more than 2 hours that have passed that they've been in the clinic. So that stomach's empty. So I'm a lot more relaxed about the empty stomach policy. In fact, I you know, if a cat's come in and somebody says to me, they actually ate their entire breakfast, I just say, okay, well, I'll do surgery maybe at lunchtime instead of doing it in the morning. So it's not a deal breaker for me. I'd much rather have a cat that's relaxed and calm than have a cat that hasn't eaten anything for 12 to 24 hours.
But that's not here.
The other thing with transporting kitties to the clinic is the carriers, and some of the carriers are getting a little challenging to get some of the cats out of, and it's so especially if you have a cat that is a little bit on the fractious side or a little bit nervous, they are not the greatest ones to put in the older carriers that aren't easy to remove the tops off of. So some of the newer carriers, either the ones with zippers that we can remove the cats easily from, or the ones with the flip lids where they just have little clips along the sides where you can just unclip and take the lid off. Those carriers are perfect for cats that are more challenging to get out of the carrier. In fact, sometimes we don't even take them out. We just take the lid off, then we just put a blanket or a towel over the part of the body that we're not examining and just sort of work with them sort of piece by piece. But that way we don't have to stress them out by moving them around too much. But those older carriers where they have those heavy bolts that you can't take the carrier apart, or we've seen carriers where they used to have those old bolts and then somebody zip tied them now to replace the bolts, or duct taped them, or sort of MacGyvered them in some way so that they never come apart. We can't get the cats safely out of those. And I like cats to have a really calm experience from the time they leave the home to coming into the clinic. And so, you know, I always think of, oh, if I was a cat, how would I like to travel to the doctor? You know, I would like to go in my bed, actually. So I like carriers to be kind of left out all the time with food or treats in them, and then cats come to love them and be really comfortable in them, and then get picked up, and not by a handle where they get swung around and it's like Mr. Toad's Wild Ride going through the door and on the back seat bouncing around. And so, you know, I like the carriers to be small enough that the cat feels safe, and they can be carried flatly and gently laid on the footwell behind the driver's seat or the passenger seat, from the right behind the front two seats, the footwell right there, where it's kind of the center of gravity of the car. That is the most stable part of the car, where there's the least amount of rocking, the least amount of light change. So a cat will feel most stable there. And you pick them up, again, not by the handle where they're swinging all around, but just gently kind of transporting them. So bringing them in a carrier like that, and if it is a nice carrier where we can gently lift the lid off and just examine them in the carrier, keep it all nice and quiet and calm. We actually have calming music that we play in the clinic. I often will spray my hands down with catnip before I touch a cat, just so that they smell something that smells nicer than the disinfectant. And so we're doing all these things to try and keep them emotionally calm. So if I get them in a carrier that I have to turn upside down and shake to get them out of, that disrupts that whole sort of calm scenario. So if you get to pick which carrier you're going to choose for these cats that don't love to just walk straight out and say, hi, I'm here, choose one that you can get the lid off really easily. Next on my list, and this is where I'm going to be a bad guy. I've seen a lot of patients coming from the shelter lately that are beyond just slightly overweight, pushing the borders of obese, and some of them are suffering from weight-related disease. Recently, we had a cat come in with some constipation issues at a very young age associated with his obesity. And there's a number of diseases that are caused by obesity. So constipation is one of them, urinary tract disease, diabetes, pancreatitis, heart disease, joint disease. These guys are being set up for a very short lifespan if they are overweight, especially if they are suffering from obesity at the age of 2. And so if we are dedicated to giving these guys the best care and the best life, that does mean not overfeeding them. And the cats in the shelter, unfortunately, aren't maybe as active as a house cat would be, or as active as a cat that had a little catio or some supervised outside time. And so unfortunately, they're not going to get to enjoy that same the same amount of food intake that a cat that has a little bit more exercise will get to enjoy. And they definitely have nothing better to do than sit around and eat, and they don't know the consequences of overeating. And so, you know, you can't rely on them saying, sorry, I'm full, don't feed me anymore. But we have to get you guys to get out of the habit of leaving them with full dishes. all the time. So I think we have to come up with some sort of way of managing the weight in general. And it's hard because I know you guys are relying on food donations. And so there's not one consistent food for us to say, well, you have to feed this much of the food, because every food has a different calorie density. In general, if you're feeding strictly dry food, only dry food, you know, for most cats in a shelter situation, they probably aren't going to need to eat more than about half a cup total per day if they are strictly on dry food. If they are getting some canned food in there, then their portion size will be even smaller of dry food. If they're eating strictly canned food, it's a harder recipe for me to tell you how much to feed, because it's going to depend if they're the 85 gram cans, or if they're 175 gram cans, you know, if they're the much taller cans, depends on the formula. So in general, most male cats, their weight should fall between 10 and 12 pounds. Female cats, it's usually between 8 to 10 pounds. If you've got a female that's over 10 pounds or a male that's over 12 pounds, you need to be getting their weight assessed, and then we need to come up with a diet plan for them. We need to figure out how much they should be eating, because again, they're probably overeating, and we're going to be getting into trouble with weight-related disease. It's easy to open a can and just sort of put the whole can in there, and the cat will eat it, but chances are we're overfeeding if we're doing that. Next thing on my list is medicating fully. So we're hearing a lot of, oh, we have that medication at the shelter. And so sometimes it makes me wonder, why do we have so much of that medication at the shelter? And so when we prescribe something, we generally prescribe for a set course or set duration. And so it's really important that if we put a patient on a treatment course, that it's given until the meds are done. Not until the patient looks better, but until the meds are finished. And so I know medicating a cat is not easy. And if a cat looks better and you're questioning, I don't really think we need to be medicating it anymore, and this cat is really hard to medicate, then reach out and let whoever you need to know that this cat is really challenging to medicate. I don't know even if it needs to receive its medication anymore. Let that person communicate with us to see what our thoughts are on that.
No, that's why we didn't do so
But
hard.
if we feel
Can't
like
reconnect.
we need to continue with that course of treatment, we can try and find an alternate way of getting the medication into the cat, so that we can make sure that they have their whole course of treatment. So I know giving pills it's the most traditional way of administering medication, but it's not always the easiest way. So transdermal gels are an option for a lot of medications, but not all of them. So not all of them can be put into a transdermal gel. Liquids are an option, but not for all of them. And to be quite honest, for a lot of things, giving a liquid is no more easier than giving a pill. I get that. So, you know, sometimes we can have a long-acting injectable, sometimes is an option, but not for everything. But we can brainstorm with you and see if there's other options. If it's just if giving meds, if we're avoiding doing that because it's too challenging, rather than stopping, let us come up with a different solution. And some of them can even be compounded into treat formulas. And again, when we look at these like overweight cats, we know they like to eat. So sometimes we just have to like compound their medications into something that they think might be food as opposed to being medication. And if you guys are struggling sometimes with just understanding how to medicate, then let either Nicole or Janet or somebody know, is I can put together some quick little how-to videos with my staff too. So sometimes we send home, like often after a dental procedure, I'll send home transdermal gels or transmucosal pain medications, but I don't, always know if it's somebody new. I don't know if, do you understand how to administer those? I'm trying to avoid too much contact with the mouth, because the mouth is obviously a sore point, but I just want to make sure everybody's comfortable with how to apply those medications. So if not, then I can put together a little video just kind of showing you guys how to do that. Disease prevention in general, just, I think over the last couple of years, I've seen really good, compliance with, shelter kitties coming in for their annual checkups and vaccinations. So I think that's really a really good measure as far as making sure that we do our best as far as preventing the outbreaks of upper resp, which is sort of the #1 problem that any shelter will have to deal with. I don't know what the setup is within the shelter, but definitely, if you have newer cats coming in, trying not to sort of directly put them in the mix with the cats that have already been there for a little while, so that you're not potentially introducing any new virus to the group. And if you have been handling somebody that's sneezing, runny nose, runny eyes, then if you have to then go and work with other cats that aren't showing any signs of any type of upper respiratory infection, then make sure that you are thoroughly hand washing. And even if you could like put a clean smock or something on over top of your clothing, just to make sure that there's no transmission from droplets on your clothing. Clean all surfaces really well with a disinfectant as frequently as possible. Those upper resp kitties, clean their noses out. If they're getting a crusty, dried up nose, clean those noses out so that they can get air exchange through there so that they can breathe. You want to humidify their air if you can, so that just makes it easier for them to breathe and get over their cold. A lot of these are herpes viruses, which they'll have for the rest of their life, and they will flare up from time to time during periods of stress, which moving from wherever environment they were before to a shelter is a period of stress. Going from the shelter to their new home will be a period of stress. So they may seem completely healthy while they're with you, and then they go into their new home and you'll get a phone call a week later that they've got upper resp. That's because they were a carrier, and then they've had a stress. Might be a lovely new home, but it's just different. So it's a stress on them, and they break out with their upper resp. So these infections, we just have to do our best to kind of minimize the exposure to new cats when carriers come into the shelter. Pretty much everything I've got on my list. I saw a number of questions flash across the screen. I didn't get a chance to read them all. So if we want to do a Q&A, we can start now.
So I can thank you very much, Virginia. That was super helpful. I've been taking notes, and we're not veterinarians, but I feel like I've been doing this for X number of years. I didn't know that. I didn't think about that way. But we did have some questions about diet. So one of the questions from Suzanne was with regard to weight. Should we be giving cats access to dry food 24/7? But the shelter right now, we do have bowls and we measure them, but we do have dry food bowls on the floor all the time.
Yeah, that's a hard question to answer because it will depend on the cat. And so, so ideally a cat in the wild, a cat living their life the way cats were originally bred to live their lives, don't eat big meals. They eat teeny tiny meals frequently. And so cat's stomach is really tiny.
Okay.
But
So-
I really don't
so
feel
they're
good because
designed-
I was puking
Sorry,
3
just one
times.
moment,
I
please.
heard. I'm sorry to hear
Wait.
that, honey.
Somebody needs to mute
But
their
I brushed
computer,
my hair,
please.
but I feel a little bit better.
Good.
It's
A
on
little bit
recording,
better is
okay?
good.
Just one
Because
moment.
I ate and then I